So the next one, see, example include the following. A patient who had a complete normal delivery at 38 weeks suffers a postpartum hemorrhage several hours after delivery. Okay, see, so the patient deliver entirely normal at 38 weeks. Okay, so that is term gestational weeks. Okay, but so after some times, okay, so several hours after delivery, so the patient suffering from postpartum hemorrhage. Okay, so in that scenario, you can quote other immediate postpartum hemorrhage is assigned. So PDX and additional code for weeks of gestation and additional code for outcome of delivery Z37.0. So do not assign O80 in this case because so the postpartum complication is present in the hospital. So that's the reason do not code O80 in this case. Okay. And another example, the prenatal history. Prenatal means before delivery. That is antepartum. Prenatal means. Okay. So the prenatal history for a patient who had a completely normal delivery at 40 weeks gestation of a live infant indicated that she had a UTI at 3 months gestation. Okay. Now the pregnant patient is delivered at 40 weeks. Okay. Without complication, but 3 months, okay, at the time of 3 months pregnancy period, so the patient had suffering from UTI. Okay, this was treated with Bactrim as an outpatient basis. There was no recurrence of the infection during the pregnancy. Okay, so the UTI is treated in the outpatient visit. Okay, so currently, so the patient did not have recurrence. Okay, so for UTI during this pregnancy, and the patient had no infection at the time of delivery. Okay, see, there is no complications. Okay, at the time of delivery. Okay, one of the complication is present during the pregnancy period, but the complication is resolved before the delivery. Okay, so that time, so there is no complication, so the entire delivery is normal. So that time you can assign O80. Okay, and additional code for weeks of gestation and outcome of delivery. Okay, so understand guys, what is the difference between first and second example?
Yes, sir.
Okay. Next, admission with other delivery. Okay, so when a delivery does not meet the criteria for assignment of code O80 encounter for full-term uncomplicated delivery, so the principal diagnosis should correspond to the main circumstances of complication of the delivery. Okay, at the selection of principal diagnosis, okay, so the patient admitted for inpatient, what is the current complication during the pregnancy period and what is the exact reason for inpatient admission. So that time you can give the reason for admission as the principal diagnosis. Okay. In case of cesarean delivery, so the selection of principal diagnosis should be the condition established after study that was responsible for the patient admission. Okay, for example, in cesarean cases, for example, the patient admitted to the hospital for gestational diabetes. Okay, so the patient admitted to the hospital for type 1 gestational diabetes. Okay, so after 2 days, okay, so after 2 days, NRFS. So the physician noticed so non-reassuring fetal heart tones. Okay, so that's the reason the cesarean is performed. Okay, the cesarean delivery is performed after 2 days. Okay, so because of fetal tachycardia or NRFS, both are same. Okay, the fetal heartbeat problem. Okay. In that scenarios, you can give the reason for admission as the principal, not a reason for cesarean. Okay, so they are saying that guideline. Okay, so the reason for admission is gestational diabetes. Okay, so the patient, for example, the patient spent in the hospital 5 days. Okay, so the first 2 days, so the reason for admission is gestational diabetes. So the physician treated for that condition only. Okay, so during the hospital stay, they noticed some fetal tachycardia. So that's the reason. So the physician performed cesarean delivery. Okay. So in that scenario, you can assign the reason for admission as the principal diagnosis, not a reason for cesarean. Okay. Understand?
Yes, sir.
So sometimes the patient admitted for repeat cesarean. Okay, the patient had previous cesarean. Now, so the patient readmitted to the hospital for repeat cesarean. Okay, so that time you can give. So the repeat cesarean is the complication of pregnancy. Okay, so I will show you how to lead the repeat cesarean diagnosis code. Second. The previous cesarean or repeat cesarean also complication of pregnancy. For example, the patient had previous low transverse cesarean, now readmitted for so transverse cesarean section. Okay, so that time you can give so complication C. Okay, complication, pregnancy, childbirth. Okay, so spell complication, so cesarean. Okay, cesarean. Okay, so previous affecting management of pregnancy. Okay, cesarean, previous affecting management of pregnancy. Okay, that is cesarean delivery. So two, so low transverse cesarean, for example. Three, do not wish to code. No, so sorry. Yeah, see, maternal care for low transverse cesarean scar from previous cesarean delivery. Okay, so this is one of the complication, guys. Okay, when the patient comes to the hospital for repeat cesarean, that is also one specific diagnosis code is there in the pregnancy complication and 082. Okay, so the O82, see the code description. The O82 code description is encounter for cesarean delivery without indication. Okay, for example, the patient had fear of normal delivery. Okay, so the patient thinking like how to bear that pains. Okay, so they are fear. Okay, so that's the reason. So the physician suggested yes, you can go with normal delivery, but the patient is fear of normal delivery. So that's the reason. So the physician performed cesarean delivery without complication. Okay, so there is no complication. When the physician performs cesarean delivery, basically any complication is identified. So the complication is life threatening of baby and mother. So that time the physician suggested unplanned cesarean deliveries. Okay, but so this is different. O82 encounter for cesarean delivery without indication. Without indication means without complication. Without complication. So the physician performed cesarean delivery. So that time you can assign O82. Okay. Sometimes planned cesarean. Okay, so some of the numbers, so they are saying date, time, some this is good time, something. Okay, so కొందరు ముహూర్తాలు చూసి సిజేరియన్ చేయించుకుంటారు. Okay, so that time we can assign O81. Okay, so the O81, sorry, 88 second is 81. Sorry, procedure. Yeah. Why O81 is not coming? One second. planned post-operative pregnancy. Okay, so go to complication, pregnancy, childbirth. So B, cesarean, planned. Okay, occurring after 37 completed weeks of gestation, but before 39 complete weeks due to spontaneous onset of labor. So A. So do not wish to code, not delivered, do not wish to code, do not wish to code, no. So onset spontaneous labor 37 completed weeks. So not this. One second. Then distress failed hemorrhage. So without indication for cesarean. O82, right? Without indication for cesarean. O82. 1 second. Planned cesarean one code is there, I think. 1 second. Okay, 75.82. 82 and okay, that's it. So the planned cesarean, so that is O75.82. So encounter for cesarean delivery without indication O82. Yeah, so that's it. That is correct. So the planned cesarean delivery one specific code, okay, and so without indication for cesarean one specific code, okay, without indication for cesarean that is O82. Okay, so next, see, a patient who had a previous cesarean delivery is admitted for a second cesarean delivery at 39 weeks. She also had a pre-existing type 1 diabetes mellitus. Cesarean delivery was accomplished without complication. Okay, so in this case, so the patient admitted to the hospital for so repeat cesarean. Okay, so the patient also had previous cesarean done so some years back. Okay, now the patient admitted to the hospital for repeat cesarean, second cesarean. Okay, so that time O34.21 series we already coded, right? So previously I already so given one code. Yeah, so this is okay. This is previous cesarean O34.211. Okay, so and additional code for you can give pre-existing type 1 diabetes. So that time to O24.02 and so O10.9. So that is type 1 diabetes pre-existing. Okay, and weeks of gestation and outcome of delivery. Okay, occasionally a cesarean section may be performed without medical indication. So we already discussed this point also. Okay, occasionally the cesarean performed without a medical indication. Therefore, there will be no medical condition that resulted in the cesarean delivery. For example, a patient elected to have a low cesarean section due to fear of a vaginal delivery. So that time we can assign O82. Code O75.82 is assigned to describe a planned cesarean delivery when the onset of labor occur after 37 but before 39 completed weeks of gestation. This code always data to be collected for quality marks for elective cesarean delivery performed between 37 to 39 weeks. Okay, so we already discussed that code also. Okay, next. Admission for obstetric care. So, okay, no problem. See, antepartum supervision of pregnancy with history of 3 previous stillbirth, 12 weeks gestation. Okay, for example, in antepartum supervision of pregnancy. Okay, for example, the pregnant patient comes for regular checkup at 14 weeks. Okay, for example, 15 weeks pregnant patient. Okay, comes for routine general checkup. So there is no complication. Okay, how to code that scenario? Okay, So I will show you. A 25 years old female patient admitted, a 25 years old female patient, G3, P2, AB0, SB0. Okay, so SB0, 15 weeks, 15 weeks. Okay, pregnant comes for routine checkup, routine general checkup. Okay, so any complication is there? Any complication is there?
Abortions and stillbirths.
That is not a complication. There is no abortion, there is no stillbirth. Now the pregnant patient is third time pregnant. Previously, so 2 times pregnant and live births. Okay, so the AB0, SB0, abortions 0, so stillbirths also 0. Now again, so the pregnant patient is 15 weeks, so comes for routine general checkup. So any complication is there?
No, sir. No.
There is
No,
no
sir, only
complication. Okay,
No.
so
No.
that time we can give supervision of normal pregnancy. Okay, go to supervision. Okay, supervision of pregnancy 6. Okay, so the supervision of pregnancy normal 4. Okay, so first pregnancy, that is primigravida. The G1 means, so that time we can consider as first pregnancy primigravida. So other than first, okay, so this is multigravida, right? So now the pregnant patient is G3. G3 means, so other than first. Okay, so that time you can consider as this option 2. Okay, so that is 15 weeks. So you can consider as second trimester. So the gestational weeks, so 15 weeks. Okay, so these are the codes. Encounter for supervision of other normal pregnancy, second trimester, and weeks of gestation. Okay, so the pregnant patient comes for routine general checkup. So that time we can consider supervision. Okay. So in this example, antepartum supervision of pregnant patient with history of 3 previous stillbirths, 12 weeks gestation. Okay, so any complication is there? Any complication?
History, there is a complication.
Okay, so 3 previous stillbirths. Okay, that is recurrence pregnancy loss. Okay, multiple times manaki pregnancy loss ayindi. Okay, so that is also one of the complication. Okay, so that is high risk pregnancy. Okay, so that is high risk. Previously 3 times pregnancy loss ayi malli ఇప్పుడు 4th time pregnant ayindi ante, so that is high risk pregnancy. Okay, so that time go to complication pregnancy. Okay, so complication pregnancy, so pregnancy. Okay, so pregnancy spell other complication. So recurrent pregnancy loss. Okay, recurrent pregnancy loss. Okay, so now how many weeks pregnant? 12 weeks. Okay, so that is first trimester. Okay, so the gestational weeks 12. Okay, so not delivered, no more complications. Okay, pregnancy care for patient with recurrent pregnancy loss first trimester. Okay, O26.21 and weeks of gestation Z3A.12. Okay, so see O09.291 now. O09.291, what is that code? O09. Second, guys. O09.291. History of multiple stillbirths. Supervision of pregnancy with other poor reproductive or obstetric history first trimester. 009.291. So I will check 1 second. Complication, pregnancy. So pregnancy, supervision, for example, supervision of high risk pregnancy, high risk low history of neonatal death or stillbirth. Okay, so the option A, see, history of neonatal death or stillbirth. Okay, so history of 3 previous stillbirths. Okay, so history of neonatal death or stillbirths. So first trimester, so gestational weeks, so 12 weeks. Do not wish to code, no more complications, do not wish to code. ఇప్పుడు ఏం కోడ్ వస్తుందో చూద్దాం. యా, O09.291. ఓకే, ఎస్. సో దీనికి డైరెక్ట్ కోడ్ ఉందండి మనకి. ఒకవేళ డైరెక్ట్ కోడ్ లేదు అనుకుంటే, సో దట్ టైమ్ యూ కెన్ కన్సిడర్ యాజ్ మల్టిపుల్ ప్రెగ్నెన్సీ లాస్ సంథింగ్. ఓకే, so but one specific code is there. Okay, so the previous stillbirth, history of previous stillbirth, so supervision of pregnancy with other poor reproductive or obstetric history. So this is one code, O09.291, and weeks of gestation. Okay, so the second example, office visit for routine prenatal care for primigravida patient with no complications. Okay, so already ఇప్పుడే మనం చూసాం. Okay, so that time go to supervision or pregnancy. Okay, SUPERVI. Okay, supervision of. Okay, so supervision of pregnancy. Okay, normal. Okay, first pregnancy, primigravida. Okay, how many trimesters? Second trimester. Okay, second trimester, but the weeks not specified. Okay, so these are the codes, Z34.02 and Z38.00. Okay, and admitted for intravenous antibiotic therapy, a patient who delivered a single liveborn at home 3 days ago. Patient now suffering an abscess of breast. Okay, so that time 3 days back, so the patient is delivered at home. So after 3 days, so the pregnant patient suffering from breast abscess, so that's the reason the patient comes to the hospital. Okay, so immediately after delivery, within 6 weeks, any complication is developed, so the specific condition considered as purporeal or postpartum complication. Okay, so that time, so complication. Okay, so pregnancy, purporium, so the option 3. Okay, that is abscess. Okay, so that is breast. Okay, 3. Okay, so associated with lactation, no. Other unspecified, do not wish to code, no more. Okay, O9112. Okay, so O9112. Okay, so a delivery triplets, one stillborn. Okay, so this is outcome of delivery. Okay, so that is different, Z37.61. so this code is given for outcome of delivery series. Okay, the Z37 series is outcome of delivery, triplet, some liveborn. Okay, so hospital admission of a patient in good condition after delivery, a single liveborn infant taxi on the way to the hospital. Okay, so that time we already discussed this code, Z39.0. Okay, so encounter for supervision of immediately after delivery. So encounter for care and examination of mother immediately after delivery without complication. Okay, so the delivery is done at outside of hospital on the way to taxi or hospital gate. Okay, so in front side of hospital gate or in home. So that time we can assign this code, Z39.0. Okay, so next. Code from category O35, maternal care for known or suspected fetal abnormality and damage, and O36, maternal care for other fetal problem, are assigned only when the fetal condition is actually responsible for modifying the mother's care. Okay, so sometimes the fetal condition affecting to the baby, the congenital abnormalities. For example, so in intrauterus, okay, the baby is still in intrauterus. Okay, so the baby have some problems. That condition is affecting to the mother. So that time you can give O series codes. Okay, that is O35 and O36. That is maternal care for known or suspected fetal abnormalities. Okay, so and fetal problems. Okay, so the fact that the fetal condition exit does not in itself, okay, justify assigning a code from these categories. This applies only when the condition affecting the management of the mother's care. Okay, code from category O35 and O36 are used when the listed condition in the fetus in the reason for the hospitalization or other obstetric care. So that is not a mandatory. Fetal condition affecting management of pregnancy, O35 and O36, like fetal heart rate monitoring. Okay, so like see, for example, when a decreased fetal movement result in a decision to perform a cesarean delivery. Okay, ఒకవేళ fetal movement మనకి decrease అయినా కూడా sometimes, okay, so they are thinking like some problem with the fetus. So that time definitely, so they preferred cesarean delivery. The physician immediately perform that cesarean delivery. Okay, so that time, so that is complication. Okay, decreased fetal movement. Okay, so that is O36.81, decreased fetal movement is assigned. Okay, so on the other hand, if no change is made in the mother's care, code O36.81 is not assigned because the decreased fetal movement is not considered to have affect the management of the mother significant. Okay, so ఖచ్చితంగా physician మనకు చెప్పాలి, so that condition is affecting to the mother also. Okay, in utero surgery. Okay, so that is different, that is not necessary. And so hypertension. Okay, see, hypertension complicating pregnancy, that time we can check for that is pre-existing hypertension or gestational hypertension. Okay, so in pregnancy, essential hypertension O10 to O10.01 to O10.03, and hypertensive heart disease complicating pregnancy O10.111 to O10.13, hypertensive chronic kidney disease O10.211 to O10.23, like. Okay, for example, the pregnant patient had, okay, for example, so this 25 years old female patient, gravida 3, para 2, AB0, SB0, so 39 weeks pregnant. Okay, so comes to the comes for, okay, pregnant, so suffering from, so CHTN, CKD stage 5 on dialysis, and acute on chronic systolic and diastolic CHF, congestive heart failure. Okay, so in this scenario, okay, so add diagnosis. Okay, for example, hypertension. Okay, HTN simply. Okay, HTN. So that option, hypertension 3. Okay, so hypertension, so that time you can select this complication of childbirth, childbirth or pregnancy. Okay, so pregnancy, childbirth or purpurium. For example, the patient is delivered, so that time you can consider childbirth. So that is chronic, means that is pre-existing. Okay, chronic ante ఎప్పటి నుంచో ఉంది. CHTN means chronic hypertension. So that time you can select this. So pre-existing hypertension. Okay, with heart and or renal disease. Okay, so with heart and renal disease. Okay, so gestational weeks, for example, 39 weeks. So single live one. Okay, so do not wish to quote. Okay, so no procedure. Okay, see, pre-existing hypertensive heart and chronic kidney disease complicating childbirth. Okay, see, in O10 series, so they are given some instructions. Okay, in O10 series, use additional code from I13 to identify the type of heart disease, heart and chronic kidney disease. Okay, so that time you can assign I13 series and I50 series. When I13 series is assigned, so under I13 use additional code for specific stage of CKD and specific type of heart failure. Okay, so that time you can code all conditions. Okay, so for example, yeah, I will try another way. So for example, complication, pregnancy, childbirth. So spell other delivery complications B. Okay, HTN, hypertension. Okay, so that is pre-existing 4. Okay, with heart and or renal disease. Okay, heart and renal disease. Okay, pre-existing hypertensive complicating pregnancy, heart and renal disease too. So do not wish to code not delivered. So do not wish to code more. Yeah. So the time as per instructions, you can code all the conditions separately. Along with O10 series, you can code I13 series, I50 series, and N18 series. Okay, you can code all conditions separately along with hypertensive heart and chronic kidney disease, complicating pregnancy code. Okay, understand?
Yes.
Okay, for example, pre-existing, not pre-existing, so that is only gestational, so that time only one code is enough. Okay, so secondary hypertension, so this is different. Okay, so we already discussed pre-eclampsia versus eclampsia, and pre-eclampsia or eclampsia with pre-existing hypertension, so that time we can give O11 series and O10 two codes. Okay, so preeclampsia complicating pregnancy. Okay, so same in diabetes, so there are so many types of diabetes. Okay, so generally class A1 and class A2 diabetes we can consider gestational diabetes, but class 3 and class 4 diabetes we can consider as normal. Okay, so pre-existing type 1 diabetes one specific code. Okay, and pre-existing type 2 diabetes one specific code. So and gestational diabetes one specific code. Okay, so these are all diabetes complicating pregnancies. Okay, next. So this is HIV complicating pregnancy also. So two codes required. So one is 198.7 series and another code like based on HIV infection, you can assign Z21 or HIV disease, you can assign B20. Okay. For example, AIDS complicating pregnancy. So add diagnosis. Okay. So AIDS, for example. Okay. AIDS. Okay. AIDS. So complicating pregnancy, childbirth. So do not wish to code, not delivered. So the HIV disease type. Okay. For example, that is so symptomatic HIV disease 5. Okay. Do not wish to code, do not wish to code. No. Okay. C O98.72. Okay. And additional code for B20 also. Okay. AIDS code also. Okay, that is HIV complicating pregnancy, even alcohol and tobacco use during the pregnancy period. So the pregnant patient is taking any alcohol or tobacco. So that is also complication of pregnancy. Okay, for example, tobacco. So C tobacco. So maternal, sorry, tobacco abuse. Okay, so complicating pregnancy. So based on childbirth, for example, the patient is delivered. Okay, wish to code type of tobacco like cigarettes, for example. Okay, 2. So 3. So do not wish to code, no procedure. See, the time smoking complicating childbirth, 1 code, and so the specific tobacco content, that is cigarettes, so 1 code. Okay, so even alcohol also same line. Okay, so when alcohol or tobacco is used during the pregnancy period, so that is also complication of pregnancy. Okay, the complication of labor and delivery. So primary, okay, secondary uterine inertia, precipitous labor. So okay, you can learn. So type of lacerations. Basic key in at the time of normal delivery, sometimes in cesarean delivery also. So we noticed some lacerations. Okay, sometimes in pregnancy charts. So the physician documented like VBAC. Okay, VBAC. What is mean by VBAC? Any idea about that VBAC? Vaginal birth after cesarean. Okay, so that is also one of the complication. Okay, vaginal birth after cesarean. Ante, so the patient had previous cesarean. Now, so the patient is normal delivery. Okay, previous cesarean అయింది ఇప్పుడు normal delivery అయితే, so that is VBAC. So that is also complication of pregnancy. Okay, VBAC means vaginal birth after cesarean delivery. Okay, so generally coming to lacerations, so there are most of the perineal lacerations, labial lacerations, vaginal lacerations, urethra lacerations, okay, so sulcus lacerations. So these are all the common lacerations, okay, developed during the delivery time. Okay, so the first degree laceration means involving the perineal skin and its extension into the vagina as vaginal mucosa. So that is called first degree laceration. Okay. So the second degree laceration involving the perineal body and deeper tissue. Okay. So the third degree laceration is involved extending into the capsule and muscles of the anal sphincter. Okay. So the fourth degree means entering through the sphincter and into the anal and rectal mucosa. So there are four degree lacerations. Okay. So like they are given, so the laceration diagram. So see, this is first degree laceration, so this is second degree, so this is third degree, so this is fourth degree lacerations. Okay. So a baby బయటకు వచ్చేటప్పుడు ఆ force కి, so sometimes so the laceration is occurred so during the delivery. Okay. So the obstructed labor, so that is, and fetal stress we already so coded fetal stress complicating pregnancy, so purpureal sepsis. So these are all direct. Okay, uterine atony. So we already coded uterine atony. So abortions, like next abortion chapter. So we will discuss abortion next. So yeah, I will give one pregnancy complication chart. I will show you. 1 second, guys. 1 second, please. Yeah, see this one of the chart like example. Okay. So this is history of present illness. Okay. So the patient is a 34 years, gravida 8, para 3. Okay. So AB2, SB4 something, 41 weeks, 0 days. Okay. So 41 weeks. Okay. So 0 days by last menstrual period, like 11 weeks, ultrasound EDC 221. So with current pregnancy complicated by, okay, OUD on, so subtext history of CD1. Okay, so cesarean delivery 1. CD means cesarean delivery 1. Okay, OED. So what is mean by OED? Complicated by OUD. OED means ఇది మెడికల్ టెర్మినాలజీ అందరూ మర్చిపోయారా? వాట్ ఈజ్ ఓఈడి? Opioid use disorder. Okay, so 1 second. Hello. Yeah, Raju, చెప్పండి. ఓకే. రేపు అదే లింక్ జాయిన్ అవ్వమని చెప్పు. ఓకే. ఓకే. సరే. మీరు నేమ్స్ నాకు పెట్టండి. మీ తరపున ఎవరెవరు జాయిన్ అయ్యారనేది నేను చూసుకుంటాను. ఓకే. యాహ్! యాహ్! అంతే. ఐపీకి 20ని. నేను అదే చెప్పాను. ఓకేనా? ఓకే. 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 రాజు. ఓకే. Yeah, sorry. So see, the OUD means opioid use disorder on subtext history of cesarean delivery 1, depression, anxiety, anemia, GBS positive, presented for TOLAC /IOL. Okay, so trial of labor, so induction of labor. IOL means induction of labor, reports positive fetal movement. FM means fetal movement. So denies loss of fluid. LOF means. Okay, so vaginal bleeding. CTX means contractions, no chest pain, dyspnea, visual disturbance, headache. So review of systems otherwise negative. Okay, so this is the terminology, guys. Okay, you can must and should understand this terminology. Okay, so in pregnancy chart. Okay, so in OB history, see the gravida one is spontaneous abortion with DNC at the time of first pregnancy. So that is abortion. Okay, so and second one is preterm premature of membrane at deliver 36 weeks. So the third one is ectopic pregnancy. What is mean by ectopic pregnancy, guys? What is molar
Tube.
pregnancy and what is ectopic pregnancy?
In tube is called ectopic pregnancy.
Yes. Okay. So the baby. Okay. So or the embryo. Okay. Or fetus. Okay. So embryo and fetus and baby and new. Okay. So the fetus is developed. Okay. So generally the fetus is developed in intrauterus only. Okay. But sometimes the fetus is developed in fallopian tubes. The type of pregnancy is called as ectopic pregnancy. Okay. So sometimes the fetus is developed in ovary. So that type of pregnancy is called as molar pregnancy. Okay. So that is also complication. Ectopic pregnancy, one specific code is there, and molar pregnancy also one specific code is there. Okay. So gravida 4 is spontaneous vaginal delivery. Okay. So and gravida 5 also spontaneous vaginal delivery. Okay. So they are given total pregnancy history. Okay. So the gynec history last pap smear to 2018. Okay, so normal patient reports history of ASCUS and LSIL, history of chlamydia status post treatment. Okay, so the past medical history OED on so suboxone, anxiety and depression. Okay, so the past surgical history hernia repair at age 7, laparoscopic, so cis, CCX, okay, contraction, cesarean delivery 1 and DNC times 2. So the previous cesarean, that is also one of the complication. Okay, medications, allergies, social history, denies alcohol, tobacco, so denies alcohol and tobacco, recreational drug use. Okay, so the patient is drug dependent patient. A review of systems. Okay, so and physical examination, OB exam. Okay, see the OB exam, so the dilation, so the cervix is dilated. So digital examination, constitutional, so SPE, so fetal heart tones. Okay, so see the fetal heart tones. So the fetal heart tones moderate variability or positive acceleration. So the time that is normal. So but so the decelerations is present. So that is complication of pregnancy. Okay, so the accelerations, okay, variability. So like so these are all normal. Okay, but so the fetal decelerations. Okay, so the decelerations is complication. Okay, but now there is negative for decelerations, only positive for acceleration. So that is not a complication. Okay, so even now the baby is cephalic presentation. Okay, so next assessment and plan. See, so 34 years gravida 8 para 3, so something 41 weeks. Okay, ultrasound. So okay, so reassuring for reactive NST. So and induction of labor. Okay, IOL means induction of labor. History of cesarean delivery once per fetal malpresentation. Okay, so previously the fetal malpresentation, so that's the reason. So the cesarean is performed. Okay, now so they started induction of labor with pitocin. Okay, so induction. Okay, so పేషెంట్ కి కాంట్రాక్షన్స్ అనేవి తెప్పించడానికి లేబర్ పెయిన్స్ తెప్పించడానికి సో దే ఆర్ యూజింగ్ సమ్ డ్రగ్స్ లైక్ పిటోసిన్ సర్విడిల్ సైటోటెక్ oxytocin. Sometimes in interview pattern they are asking like some question. Okay, like so what are the drugs used for induction method? Okay, induction of labor method. So one is pitocin, Next one is oxytocin, cervidil, and cytotec. Okay, so these are the common drugs used for induction method. Okay, so we'll discuss TYLC, RCD, all questions, patient. So TYLC, cephalic fetal presentation. So membrane intact. So history of cesarean delivery 1, fetal malpresentation. So OUD currently on suboxone. Okay, so this is current complication, and anxiety and depression also current complication. Okay, so yeah. Okay, so cesarean delivery 1 complication, anxiety and depression 1 complication, OED 1 complication, and anemia also 1 complication. Okay, so the anemia also 1 complication. So next, these are GBS positive. Okay, so the group B streptococcus positive, this is also one of the complication. Okay, so these are all the complication of pregnancies. Okay, so next, postpartum plan, breast and bottle so feeding, desires IUD at PPV for contraception. Okay, IUD means intrauterine device, so that is not necessary. Admitted for delivery and postpartum care. I personally evaluated the patient, have reviewed like something. So induction of labor with pitocin and labor management as noted, anticipated evolution, spontaneous vaginal delivery. So the pregnancy history something. So they are given pregnancy 1, pregnancy 2, pregnancy 3. So that is not necessary. So procedure. Okay. So the chronic problem list, smoker, procedure and surgical history. So home medications, allergies, social history. So denies alcohol use. So substance use. So tobacco, medium. So cigarettes. Okay. See, everyday smoker, cigarettes 5 per day. Okay. So you can quote tobacco complicating pregnancy. Okay. So it is clearly documented like cigarettes 5 per day. Next. Yeah. In assessment and plan C. So any other new complication is identified. So trial of labor, induction of labor complicated by OUD, depression, anxiety, anemia, GBS positive. So induction of labor. So AROM at this check with clear fluid. So artificial rupture of membrane, that is procedure, not a complication. So same complications here. Admitted for labor and delivery. So 41 weeks. So that is post-term delivery. That is also one of the complication. So the post-term delivery also one of the complication. So subjective. So next, physical examination, postpartum assessment. Second. Yeah, lacerations well approximated. So let's check colors. Okay. And umbilical cord around neck, that is also one of the complications. So in this case, so they are documented or not, we will review once, right? So VBAC, see, it is documented VBAC. Okay, now status post VBAC, vaginal birth after cesarean, pregnancy complicated by OUD, history of cesarean delivery 1, depression, anxiety, anemia, GBS positive, elevated BP. Okay, so elevated BP also is identified here. Blood loss 150 ml, discussed advanced diet. So constipation, management and ambulation with patient, OUD. So successfully VBAC, depression, anxiety, anemia. Any delivery, yeah, delivery information, baby A. So see, induction of labor or augmentation S. So birth position, bed adjustment, use of food. So this is cephalic presentation. See, presentation at delivery, cephalic presentation. That is normal. Okay. So delivery type PCM, vaginal spontaneous vaginal delivery. Okay. So the delivery is normal delivery. Meconium at delivery not present. Meconium means that is first stool of baby. Okay, so the meconium is present. So that time you can the meconium is aspirated. So that is also complication of pregnancy. Okay, so and see placenta delivery PCM. So spontaneous vaginal delivery laceration. See first degree perineal laceration also is documented here. Okay, so just now we discussed lacerations, right? So the laceration first degree perineal laceration also is documented here. You can quote first degree perineal laceration also complicating pregnancy. So the baby is live, one single baby. Okay. So these are all medications. OB-GYN progress notes. Okay. So progress notes, you can see directly assessment. So any other new complication is documented here. Lab results, chemistry. Yeah. 34 years, gravida for VBAC, OUD, anxiety, depression, anemia, GBS positive. So gestational hypertension. See, so the elevated BP, elevated blood pressure is documented. So it is here. ఇక్కడ మనకి gestational hypertension అనేది డాక్యుమెంట్ చేశాడు మనకి. Okay, gestational hypertension. So history of cesarean delivery, depression, anxiety. So VBAC, anemia. So these are all post-term. So these are all the complication of pregnancies, first degree perineal lacerations. Okay, so these are all complication of pregnancies. Yeah, so this is delivery record. See, so IUP 41 weeks. Okay, so previous cesarean delivery. Okay, so OED and suboxygen, history of depression and anxiety, induction of labor. So GBS positive. So the baby A, okay, so female, okay, female baby live birth, okay, the baby A means that is single baby, okay. See, the cord around neck times one, okay, so this is also one of the complication, guys, okay. So the entire live chart is different. So first you can review the chart, each and every line, you can identify the complications. So after that you can leave the complication coding. So 3M. Okay, so this is cord around neck. So that is also complication. So the vaginal laceration repair is performed. So the first degree perineal laceration repair is performed. That is procedure. Okay, normal delivery one procedure and laceration repair is one procedure. And so the pitocin is given for induction purpose. So that is also one of the procedure. Okay, so this is ROA presentation. So the laceration is repaired with 5 cc lidocaine and repaired with proline sutures. Okay. So this is the delivery record. Okay. So when see when RH negative is documented, that is complication. So the ABO RH positive, so that is not a complication. Okay, so the RH negative is the complication of pregnancy. RH positive is not a complication. Okay, recess isoimmunization RH means. Okay, any COVID positive. So that time you can code COVID positive code also. So these are all labs. These are all labs. Yeah, that's it. Okay, so the time you can lead all the diagnosis like, so go to complication. Okay, sorry. Complication, pregnancy, childbirth. Okay, so spell other complication, for example, postterm, because so the patient is 41.0 weeks post dates. Okay, so 40 weeks, no, sorry, 41 week 3. So single live born, spell complication. So GBS, so group B streptococcus. So carrier stat only. Okay, do not consider as infection. I will tell you when we consider as infection. Okay, so do not wish to quote. Next, spell complication, laceration. So that is perineal. Okay, so perineum or perineal. Okay, so option 9. So that is first degree. So you can select the option 3. Do not wish to quote. Complication. So tobacco. So yes, so that is cigarettes. So 3. Do not wish to quote. Spell complication. Gestational hypertension, hypertension gestational, spell complication, anxiety. Okay, so 3. Anxiety specified as unspecified. So do not wish to quote. Spell complication, depression. So 3. So C unspecified, do not wish to quote. Spell complication, nuchal cord, nuchal cord without compression. So spell complication. So opoid. So that is drug. Okay, so drug dependence or usage. So that is opoid B. So use only are unspecified. So 4 other are unspecified. Alcohol use no. So any other complication? So previous cesarean delivery. Okay. So previous cesarean, no, cesarean. So previous B. So cesarean delivery 2. So 7 unspecified. So no, no more complications, right? Any other complication? Any complication is missing?
Anemia.
Yeah, very good. Okay, so anemia complicating pregnancy. Okay, so spell complication, anemia. Okay, so anemia unspecified. So no procedure. Okay, so these are the codes, guys. Okay, so postpartum pregnancy, weeks of gestation, GBS positive, first degree perineal laceration, smoking, tobacco, 2 codes. Sorry, gestational hypertension, 1 code. Okay, so this is anxiety with depression, pregnancy complication code, and additional code for anxiety and depression. So this is nuchal cord around neck. So this is drug abuse complicating pregnancy, 2 codes. Okay, so this is previous cesarean delivery. This is anemia complicating pregnancy. So this is single live-born outcome of delivery code. Okay. సో బేస్డ్ ఆన్ ఎక్స్పీరియన్స్ ఓకే సో చార్ట్ రివ్యూ చేయడం అలవాటు అయింది ఒక 10 చార్ట్స్ అంటే మనం కొంచెం ఫాస్ట్గా ఇలా నేను ఇప్పుడు చూడండి అన్ని కాంప్లికేషన్స్ ఎలా గుర్తుపెట్టుకొని టక్టక్గా చేశానో అలా చేయొచ్చు లేదు ఇన్ లెర్నింగ్ స్టేజ్ యూ ఐడెంటిఫై ద కాంప్లికేషన్ ఇన్ దట్ పర్టికులర్ పేజ్ యూ కెన్ లీడ్ ద డయాగ్నోసిస్ ఓకే లేదు అంటే మీరు మర్చిపోతారు మళ్ళీ రైట్ సో టుమారో we will discuss 2 more charts. After that I will give 10 more charts for practice. Okay.
Okay, sir.
Any questions?
No, sir.
Okay. Okay, guys. Okay. Bye. Can I share
Thank
this
you, sir.
operator? Can I share this case study? You
Yes,
can review
sir.
once again.
Yes, sir.
Yes, sir.
Okay. Okay, guys. Okay. I will give you this case study. Please practice this case study. Okay. So based on practice only, you can understand. So tomorrow I will give some suggestions how to read the case study. Okay.
Okay, sir.
Okay, sir.
Okay, guys. Bye.